Just a quick video to go along with watching the lab for some of the other vocabulary words. So we have first the Institutional Review Board, and this is the people who will kind of determine the ethicalness of any study that you may complete. So for example, if you've taken 301, you will have heard a lot about these things. That we had like the Tuskegee study where there were men who were being given syphilis down in Alabama, and they did not treat them even when they found a cure because they wanted to see what would happen to the disease. So when this sort of thing happens, then we had a lot of unethical things going on, and so now we have review boards. We have them at every hospital, institution, so they're there to help us determine whether or not something is ethical. The next thing we have to do for ethics is we always have an informed consent. When you give a study to anybody, they'll first have an informed consent, and you'll see one of these when we do a study later in the semester. The informed consent should list a summary of what the study, including any risks that could be involved in the study. And then at the end, the participant or respondent needs to agree or disagree. And if they disagree, they can't participate in the study. If they agree, then they move on. Next, we have the principal investigator, which is a professor who generally oversees the study. It's whomever is in charge of that study. They're the ones that will be held responsible if anything ethical happens. Of course, they'll have assistants who will help them actually carry out the study, but the principal investigator is the one in charge. Next, CITI Training. I don't know that there's much to explain here since you all should have completed your CITI Training. It's a protocol to make sure that we understand what is necessary in doing research to make sure all important areas are covered. And that wraps up the vocabulary that goes along with research ethics.